These 12 indications your body will give you if your kidneys are at risk. Liver illness is a silent killer, as everyone who has experienced it, is experiencing it, or knows someone who is experiencing it can attest to. The fact that it is discovered at a very late stage increases its danger, the majority of individuals. Few people have sufficient education to understand that the signs of renal illness include not silent, but they are so unnecessary that it doesn't matter. Unfortunately, in certain instances, the symptoms could not even appear until the illness is essential. This emphasizes how important it is to understand and identify the symptoms even more. Remember to turn on notifications and subscribe to our channel before we start. You never fail to notice our latest. These are now the top 12 indicators of renal illness that you should be watching out for. 1. Modification of urinary function. Changing urinary function. A shift in the frequency and volume of urination is the first obvious symptom of kidney disease. The amount of pee you pass may dramatically rise or decrease. Occasionally, you may also notice a deeper hue change in your urine. Additionally, you can have a strong urge to urinate, but find that once you're in the bathroom, you can't resist. In summary, it is advisable to begin observing and documenting your daily bathroom visits if you notice any changes in your urine function, difficulties, or pain. While urinating, attempting to relieve your bladder may cause you to experience pressure, discomfort, or difficulties. This could indicate that you have an infection of the urinary tract. Although it is easily treatable, it is advisable to diagnose it as soon as possible because it may spread to your kidneys and cause fever and neck ache. 3. Blood in the urine. This is one of the symptoms that is impossible to ignore and is a direct reason to be concerned. Thus, don't dismiss this if you see it. One of the most obvious signs of renal illness is blood in the urine. If this symptom has appeared, you should see your doctor right away because a number of bladder tumors may also be linked to blood in the urine. 4. Foamy urine. I realize you're probably thinking that the bladder alone is the cause of many of these symptoms, but the kidneys and bladder are closely related. So when the kidneys fail, the bladder is the first organ to be impacted. 5. Swelling or edema. Your kidneys eliminate all of the extra waste and fluid in your body. Your body accumulates this additional waste and fluid when they are unable to do so. The person will get puffiness in their cheeks, hands that are too tight, and edema in their ankles and feet when this happens. 6. Extreme fatigue. A hormone called erythropoietin, which aids in the oxygen transport of red blood cells, is produced by healthy kidneys. These hormone levels sharply decrease as your kidneys fail. Your body becomes exhausted and feeble as a result of this abrupt decrease in red blood cells. 7. Dizziness and inability to concentrate. The brain is likewise impacted by this oxygen shortage when your kidneys are the source of your dizziness and inability to concentrate. Weariness. You can feel lightheaded and find it hard to focus as a result of this. The explanation is because the brain runs more slowly when it is oxygen-starved. 8. Feeling constantly cold. Anemia, which can be brought on by renal illness, can make you feel cold all the time, especially in warm places. Fever and chills can also be symptoms of a kidney infection called pyelonephritis. 9. Skin rashes and itching. Although this symptom is sometimes mistaken for other skin rashes and itching diseases, like allergies, the rashes may actually be a sign of renal failure. Renal failure is the source of this, and it also raises the level of waste in your blood. Skin rashes and extreme itching are brought on by this 10. Ammonia, breath, and metallic. Blood urea levels rise with renal failure, metallic taste, and ammonia breath. When this happens, the urea in the saliva is converted to ammonia, which results in ammonia breath, a terrible breath akin to P11. Constant nausea and vomiting. If your kidneys are failing, you will constantly feel queasy and throw up. It won't happen just once. This is what you'll encounter most of the time. This is because the body needs to expel the accumulation of waste products, which is why vomiting occurs. 12. Difficulty breathing. If renal illness has progressed to a sufficient degree, it may result in an accumulation of fluid in the lungs, which may induce dyspnea. In connection with this, your body will starve of oxygen if you have anemia, a condition related to renal illness. It's crucial to keep in mind that kidney impairment is not always the result of experiencing any of these symptoms. Even if many of these symptoms are associated with other illnesses and infections, it's still worthwhile to investigate them or speak with your doctor if you encounter them. Both your kidneys and even your life may be saved by them. Enjoyed this video? Hit the like button and subscribe to our channel for more videos like these. Thanks for watching!